Calcutta, November 2000, and people are arriving to start a revolution. 20 years ago, in 1978, the World Health Organization meeting in Alma called for health for all by the year 2000. 2 decades later, and the world is still waiting. Today, people are asking why health for all not only hasn't happened, but why more people's health is actually getting worse.
In Alma we came out with stars in our eyes. And then what happened? And why did it not happen?
For the poor, you don't have to explain that you need a change. Everybody knows they need a change, they just don't know how. You don't have to teach them to say that you don't have something. They know they don't have it.
Most of the world's people don't even know what to protest yet. And so our big challenge is helping people realize what are the forces, the worldwide forces, which are affecting their health and well-being today.
Can we find our way back to that? Do we have the memory? And do we think that somehow we have, in this dismal picture, what's happening to the poor in the world, to resuscitate our faith that we can still make a damn difference in this miserable world of ours?
The promise of Alma wasn't just a rallying call, but a whole philosophy of healthcare for everybody, by everybody.
1978, 150 countries or whatever it was got together and said that we need to develop a model of primary health care which delivers generalist services locally, which uses appropriate technology, appropriate labour force models, but very importantly, which involves local communities in thinking about the problems they're facing.
You know very well the Alma Declaration in 1978, that is health for all by 2000. But what is the position now? Not only health is not available to all the people, but the morbidity rate and ill health is increased day by day.
At Calcutta's main railway station, over 2,000 people arrived from all over India for the National Health Assembly. Health workers, activists and campaigners from across the world have spent 2 years building up to a series of national rallies to revitalise the health for all dream. Many are a new generation who've inherited the dream, but know that more of the poor have no access to healthcare than ever before.
But I also believe that health for all contains the ingredients of a genuine social revolution of our times.
How are we going to give health for all? Health is not a commodity that you can go and buy over the counter. It's not something somebody can give you.
Health for all can never be achieved unless the people take over. And health needs to be their goal and their target, and the technological choice should be the choice of the people.
The agenda has moved on since 1978, and there's a new bogeyman: globalization. 50,000 people turned out for India's National Health Assembly rally in Calcutta. Delegates, local campaigners and school children brought one part of the city to a standstill. It went on for hours and way into the night.
Village people, they don't understand this globalization, but their basic needs, food, water and also basic hygiene are essential. This the people like. And so this kind of assembly is needed to voice these among the people. This is basically why we're taking part.
The day after the rally, but the protest goes on. Globalization, free market economies and privatization are all claimed as enemies of primary healthcare. And, they say, the poor have been increasingly excluded from this new world order, especially when it comes to medicine.
The disparity is growing, On one hand, the commercial purchasable health service is available to those who are the elite sections of population. On the other hand, the downtrodden sections, those who live on the human resource and the natural resource, basically, who are fighting the battle against the monetary capitalists and the market-oriented sections.
The maternal mortality rates of third world countries is one of the grossest obscenities of the present regime under which we live, compared to Western countries where you get sort of a handful of maternal deaths per 100,000 live births. In many countries you're getting up to 10% of women dying in childbirth. 1%, 2%, 3%, whatever it is, they're far in excess of what we expect in the north.